now with a GMA health alert. It's summertime, and that means people like me, weekend warriors, are out there getting all sorts of strains, breaks, and other injuries because it's outdoor activity. Travel and heat, all of the above. And who better to talk about all this than ABC News medical correspondent Dr. Darien Sutton, who is a practicing emergency medicine physician. This is busy season for you.
Extremely busy. Studies show it actually increases by up to 20% for these sprains, strains, orthopedic or bone injuries during the summer.
But here's the big question.
Yes.
Hot or cold? What's
Great
the
question.
answer, Doc?
So you always want to start with cold. It's most often, I would say, start with cold. And the reason why, think about rest, ice, elevation. When you injure yourself, you fall on that hand or you twist that ankle, you want to rest, you want to ice it, you want to elevate it. That helps with numbing. That can help prevent the progression of swelling as well as bruising. And it can also decrease the inflammation in that area, which can hopefully help you heal faster. Now, after that, once that acute or sudden injury is over, once the swelling has gone down, that's when you apply heat. That improves blood flow. Think heat for healing.
Okay, what about creams and patches? We always see these.
Yeah, we always do, and you have to understand that creams are made differently. The most common ones are what we call counter irritants. These are what make your skin feel cold or hot. The purpose of that is to distract your brain, and so that can be helpful for things like muscle strains as well as arthritis. But there are other creams that you'll see in the over-the-counter aisle, I would say. Some of them, for example, provide medications. For example, diclofenac. It provides an NSAID or a non-steroidal anti-inflammatory drug similar to ibuprofen or Motrin. That can be helpful for sprains, for strains, and also for arthritis. And then there are numbing creams that can be often prescribed, like lidocaine, that can help with nerve pain. So know that there are different cream options and they do different things.
What would you do for a bee bite? I think that's something, I've had a lot of them in my day. My kids are really worried about getting them. What would we do?
Early ice is really helpful. I know, keep it as simple as possible. And a lot of the time, some of these creams can be irritating, especially for kids. They have sensitive skin, so you want to make sure to be cautious. So I try to keep it as simple as possible.
Excellent. Compression to manage pain. Who's a good candidate? Where does it work? How does it work?
So compression can help with pain, but most often it really helps with swelling. We know that, right? Because when we wear those compression devices, it makes swelling go down. So if you have acute or chronic, that means sudden swelling or long-term swelling, that can help. It can help with blood flow return to your heart. And it can also help with varicose veins. Many people deal with that. It can be unsightly and they sometimes feel frustrated with it. Know that when you wear compressions, it can help prevent the progression of varicose veins.
And in the short time we have left, when do you go see a doctor?
Yeah, so when I listen to patients, if you hear a pop or a crack, number one, I'm concerned that you might have a fracture. If you can't bear weight or if you're having pain moving, you need to get an image at the very least or be evaluated. Also know that pain is a symptom, not a diagnosis, so make sure you get to the bottom of it because when you don't know the cause, that can lead to overuse of pain medications and frustration.
Amazing.
So figure out if it's your muscle, your nerve, your tendon, or your bone.
So much news we can use. Thanks, Dr. Darien, as always.